Good morning, everyone. This is Phil Pugh. We're going to get started here. We'll give ourselves about another 30 seconds. I know it's 10 o'clock, but we'll get started in about 30 seconds. We want to give folks an opportunity to jump on, and we'll do a roll call, and we'll get started. As a reminder, please have your phone on mute if you're not speaking to reduce any background noise. We greatly appreciate that. Hopefully, for those folks who are joining via Microsoft Teams, you can see the slides now. I know we do have a bunch of folks that are on the call that are dialed in directly. So it looks like we got about 32 folks on, and I know some folks dial in and use computers. So, but we'll get you all accounted for here shortly. Stand by. All right, let's go ahead and do a quick roll call. So we will start out with our hospitals. We'll start out Anderson Hospital. See if I see Eric on here. Nope, not yet. Maybe he'll get in here. Alton Memorial.
Good morning, Phil. It's Ashley.
Hello, Ashley. Good morning. Boyd. By chance, is Nancy on from Boyd? No? Okay. Carlinville Area Hospital. Staunton.
This is Sue. I'm here.
Good morning, Sue. I see we have Tina on. Good morning, Tina from Fayette County Hospital. How are you? You just hit your mute button. I saw that. Okay. Gateway.
Good morning, Phil. It's Rick.
Hey. Good morning, Rick. Is Danielle with you or just you today?
Just myself. She's on a call. We're switching out, transitioning Pyxis machines.
Oh, wow. That sounds like fun. Great. All right. How about HSHS Holy Family? St. Elizabeth's?
Brad's here.
Gotcha, Brad. And I see another familiar face in here too. Stephanie, are you there? I see you. Let's see who else. St. Joseph's Breeze.
Good morning. Mandy's here for St. Joseph's Breeze and St. Joseph's and Highland.
Thank you, Mandy. Jersey.
Here.
Okay, who was that? I'm sorry, there was some background noise.
This is Kelly. I'm here.
Gotcha, Kelly. Perfect. Thank you so much. All right, from Memorial Hospital in Belleville, you got myself, Scott Klosterman, who is actually on a, he's right now manning our observation area in our vaccination clinic right now, but he's listened in, he's tuned in. Lee's here, Eric Perham is here as well, but they're down in the clinic, but they may be monitoring from abroad. So represented there. Chester.
Georgia's here.
Good morning, Georgia.
Morning.
St. Anthony's. Oh, what's that?
Good morning, Phyllis. Gary's here.
Hey, Gary. Good morning. All right. Redbud Regional.
Tara and Diane are here.
Thank you, Tara and Diane. How about Sparta?
Dale and Dan are here, Phil.
Outstanding. Touche.
Eric is here.
Gotcha, Eric. Move over to our health departments. Bond County. No, Terry. Okay, Calhoun. Clinton County.
Stephanie here.
Good morning, Stephanie. Eastside Health District. Fayette. Greene County.
Hi, this is Tracy from Green. Molly will jump on here shortly.
Thank you so much. Jersey County. Macoupin.
Eric here, Phil.
Gotcha. Thank you so much. Monroe County.
Vicky here.
Gotcha, Vicky. Randolph County.
Deborah's here.
Good morning. And St. Clair County. Was Sam able to get away? Nope. Was Mila? Nope. They are down at their clinic at the fairgrounds, I'm sure, today. Okay. We'll move over to our community partners. REMSC. Greg, are you on?
I am on, Phil.
Is Ashley there with you, or is she called in separately? Ashley, are you on?
Hi, Phil. I'm here.
Gotcha, Ashley. Thank you. Beth Busman, our emergency response coordinator. Any BJC partners? Any emergency management agencies? Okay. Because I forgot to add it on this slide, I'm gonna go to Abbott first. Abbott ambulance, are you guys on?
Hi, Phil. Leslie's on.
You see, I remember. You see, I did, even though I forgot to put it on the slide. I said I'm gonna make sure I remember. Gotcha, Leslie. MedStar. I see John is on. I don't know if Chuck's on as well, but I do see you're on, John. When you get unmuted or if you're dealing with something crazy, just holler at me. And I know Helen is on.
Good morning, Phil.
Good morning. Any of our Scott Air Force Base partners? And stars. I think I saw Dale on.
Yes, sir. Good morning.
Yes, sir. Thank you so much for joining. Anyone I did not call?
Hey, Phil, you do have John Nowak, and Chuck Kelly had to step away for a few.
Not a problem, but thank you so much, John, for taking time out.
Hey, Phil, it's Stacy from Chestnut Health Systems.
Yes, ma'am. Thank you, Stacy. Anyone else? Okay. I have to roll call. Just as a reminder, this is being recorded and will be uploaded later today to our YouTube page. So if you're not subscribed there and you need to go back and look at any old YouTube videos, you sure can. So please make sure that you guys have subscribed. And if you don't want to be recorded, feel free to click the button right now, and then we'll press on, and you can just listen in later. All right. Welcome again to another month. Another COVID month, but we're moving through it. We're going to talk about a few things. They will do a quick COVID update with regard to patient census, a few things with regards specifically surrounding that, and some update issues with regard to EM resource. I know Greg will probably have some notes from IDPH, and Ashley has asked to speak with us today, and we're super happy to have her back in the mix over here. She's visited before. She is a friend of the coalition, and I'm sure she's going to impart some good information, and we'll move on from there. Then we'll move over to STARS and then our regularly scheduled program. So we'll go ahead and start just with general COVID update. This is the curve. If you guys are looking today, I think we're at 153 inpatients, COVID positives, and PUIs yesterday. But I love to see that curve going down. We were, a month and a half ago, we're looking pretty bad, but that curve has begun to remain fairly steady with going down in our PUI and COVID positive inpatient census. So great work there, guys. I'm hoping you guys, your frontline staff, are feeling some of the relief from maybe not as having as many COVID patients. So we'll get a chance to talk about that here in a minute. Just some more regional data. Again, we are, as you can kind of see from this the state map, we are the only state still in tier 2 mitigations. We got a lot of folks in phase 4, and the rest of the folks in tier 1. We're still the outlier, with tier 2 mitigations. It is not due to positivity rate, because as you can see, the positivity rate is at 6.5% across the region, which is low, and we've been steadily going down. It is our ICU bed availability is really where we are struggling. We don't have a ton of ICU beds. By my count, we have, and by the state's counts, we have 109 beds. And we really got to get above that 20 percentile. we have been floating, as you can see, that's a rolling 7-day average. We've been floating right around 19% for, the better part of the last 7 days. So we've got to get above that 20%. Now, I looked at the day-to-day calculations over the last 6 days, and we have been over the 20%, which is going to be good, but we were below it yesterday. So hopefully we'll make a turn for the better here soon as we do continue to see those percentages going down. Now, keep in mind, this has nothing to do with positivity rate or COVID positive patients in ICU beds. It is just your vacancies or your open beds that you have for you. So don't confuse this with COVID availability or not. I do understand, at least from what I gather from our side here, I'll just say in Memorial, is that since we have opened up some more surgeries that require ICU beds, that's taking up some of those beds for us. I'm just speaking here from a Memorial perspective. So for those of you who are doing surgeries and, maybe open hearts or whatever that may require, or just have regular patients that are just sick and need ICU care, they're taking up some of those beds, and it may not be, again, a COVID positive individual, but I can tell you that the state is looking at that. I will say politically, and this is not a political forum, but I would just want everybody to be situationally aware that folks are looking, obviously, to I won't say get back to normal, but you have locations around here that are opening up different sporting events and stuff like that. And folks want to be able to partake, but they want to make sure that we're doing it properly and in line with the state. So if you have any doubts in what your numbers are, please let me know. I can assist. I know I went through a few things with our staff here and how we were reporting. We weren't always reporting as accurate as possible. We just had a meeting right before this meeting to look at ICU beds and looking at that availability and what our denominator is, which one is our capacity. We took another good look at that to make sure that we're accurately reporting, and we should be going forward. So if you have any questions, please reach out to myself. You can always reach out to Greg, and we'll try to make sure that we're staying on top of it. It's in my part of my due diligence. I've been looking at a lot of COVID numbers, but I will be looking at those capacity numbers every day, before the reported time of 10 a.m. That's when we have to do our daily reports. So I'll be looking at those pretty strictly, and I may give you a call or someone at your organization a call to make sure that those numbers are right. Because we somebody fat fingered numbers in twice last week for us. One was on the med surg and one was on the ICU side of the house. I've added a new chart to this. What you're seeing there in that chart that Excel chart on the right, that table. Those are our counties, and those are the vaccines that we've administered so far. So across the region, we're almost at 53,000 vaccines administered, and with about 10,899 folks fully vaccinated across the region, giving us a 1.88% fully vaccinated rate. There's about, I'd say across the region, I want to say we're around, if I use the entire region, we're around somewhere around 750,000 folks here. But your individual counties are there, and who's leading the race right now? I think it's Jersey County, if I'm not mistaken. Oh no, Calhoun County, 3% totally vaccinated, which is great. So I'll be, hopefully I'll try to I want to do something like this maybe weekly. Definitely will be on our monthly charts, but I'm trying to figure out a way I can kind of grab this data and just kind of, send it out just to keep everybody situationally aware going forward. So maybe a weekly update, maybe every Friday or every Monday, I'll update the last weeks or something like that. So any thoughts, concerns, questions with regard to anything on this slide? Nope. Okay, great. Then we will move right into our updates. Now, I have on here, I probably should have had this in the reverse order, so I'll skip to the next slide. I'll start out with Greg, and then I'll allow Greg to tee up Ashley coming in. So Greg, can you provide a quick update?
Well, Phil, I'm going to cede my time to Ashley Haley because she needs to get going, probably on some other calls and that. So I wanted to give her the opportunity to talk. So Ashley Taylor, as most of you know, is the chief of EMS and highway safety. During this response, she has been given additional duties as it relates to vaccinations, the hospitals, that kind of thing. So Ashley, if you would like to go ahead and speak, that would be great.
All right. Thanks, everybody. I hope you can hear me okay. So thank you again for allowing me a little bit of time here on your call. I know that you guys have been very busy and you're all doing a really great job. As far as the hospital data is concerned, you know, I think Phil said it very, very well about how important it is to ensure that the information that you're putting into the system every day is accurate. You know, there is a lot of talk and hustle and bustle out there about Region 4 in particular in Tier 2 right now. So we want to make sure that we can, you know, provide an accurate picture of what's going on from a day to day. So ensuring that you guys are working with your hospital staff, reaching out to us if you need assistance in how to document, if there's any questions about your capacity or the definitions related to capacity and availability. Please let us know as soon as possible so that we can ensure that every number that gets put into that system is accurate. If you use a centralized reporting system, which there are health systems out there that do that, and one person at one facility in that health system is documenting those numbers for all of the hospitals in that system, please ensure that you at the local hospital, at your hospital, are looking at those numbers to make sure what they're putting in there is accurate. We've seen corrections that have needed to be made from that occurring because that person is not actually physically located at the hospital. So just make sure that you're double checking those numbers. One of the other things that, as I wear multiple hats through this response, I wanted to come and talk with you on the phone on this call today was about monoclonal antibody therapy. I know that you guys have continued to have ICU patients and med-surg patients in your hospitals admitted day to day that do have COVID. So we want to get the word out as much as we can and help people understand that there is this strategy out there to give monoclonal antibody therapy in hope of preventing severe illness and hospitalization for those outpatients who may be deemed a high-risk individual. So those are over the age of 65 that have chronic illnesses, hypertension, even patients under the age of 18 if they have chronic illnesses too, based on the emergency use authorization. So that's something I wanted to put out to you all. I also wanted to gain a better understanding on this call of those individual hospitals who have been allocated supply. Are you using it? What are the barriers that you're experiencing to actually infusing the therapies that you do have on hand and have been allocated? So I would open that up to you all on this call to provide me with some feedback if we can do that. So Phil, if we can have anybody who would like to provide me some feedback on that, I would like to hear it.
Sure, most definitely. So yeah, to the team that's online, if we can, I don't know if we want to go down hospital by hospital, but if you'd like to either raise your hand, if you don't have the capability to raise your hand in the chat, then we'll kind of go one by one. But anybody want to shout out first? Tina, were you about to say something? I saw you light up. Okay.
Hey, Phil, this is Rick.
Oh, go ahead, Rick.
I'm trying to get an accurate, we've probably done 10 to 20 infusions to date. So we are, trying to broaden that as much as possible, but we've had a good response. Unfortunately, my co-chair is another conference call, and she can't speak to the, supplies and or the quantity thereof. But to my knowledge, we've not had any problems in getting the antibody. And it's been successful. So we've seen some positive results with that. I know 10 to 20 is a broad range, but I will try and get a more accurate, definitive number before we're off this call.
Thank you. And what hospital are you from, may I ask?
That was Gateway.
Gateway, okay.
For us here at Memorial, I'll say this: we supply's been great. I did just get off a call right before this one. I just don't remember the total number we've done, but I know across the entire BJC system, we are approaching the 500 mark across the entire BJC system. I think our contribution is somewhere around the 60 to 70 mark, if I'm not mistaken. But that is increasing. That is increasing each week, and a lot of it was, PA, PR, with the community physicians and the like to make sure they knew about the availability. We work extremely hard with making sure that they are able to see that as something as a positive benefit and its availability here locally. And numbers have steadily increased. As far as the supply side, I'm talking with my pharmacy director. He said supplies are really good, and we're almost to the point where we've done enough folks across the system that we can start to look to see if we have any recidivism is not the right word, but any readmittance or any of those patients starting to see their way back into a actual inpatient setting. So I can get you the exact numbers, what we've done, but I just don't have them right in front of me.
Thanks, Phil. And then one thing that we are also doing, just so you are all aware, we have recently put out some flyers at the community-based testing sites. And that flyer is a very simple, easy to understand patient, or, I don't want to say a patient because they're not patients, but for the community members. So if they're at a testing site and they're getting tested, what would they do if they were positive? So it kind of instructs them on, okay, now that you've been given your positive result, how do you find a location? Well, that information is provided on the flyer. How to reach out to your trusted healthcare providers to get guidance on how to get to a treatment or determine if you are high risk and how to get treatment. One of the other things that we did this morning is I worked with our IHA partners. So the hospital admins should start seeing some flyers that we created for healthcare providers. So getting those out to the hospitals and having the communications teams push those out to the primary care providers that you are all working with, to let them know that they can go to this one click and see where all of those infusion locations are that have been allocated supplies. Because not only do we work with the hospitals and give allocations to them, we are also working with infusion centers. Dialysis centers are starting to pick this up and receive allocations through a different method through HHS, which is called Project Speed. So as we continue and progress through this, the availability is out there. The drug supply is also out there. So the more people we can identify that meet those high-risk criteria, the more we want to be able to do that. So ensuring that your hospitals and your primary care providers have a mechanism for identifying those people that come up positive but do not need hospitalization is something I really wanted to stress, because that could potentially help with your bed availability numbers as well. So if we can prevent severe illness or hospitalization. So I really wanted to put that out there. And if you guys have any questions about it, or you have any issues with your allocations or anything, you can reach out to me. If you have infusion centers or anybody that you know of, that would be something I would like to hear too. Like, this would be a really great location for us to start, allocating to. We would want to hear those. We've also been working with skilled nursing facilities across the state that have the capability to provide that medication to their patients and monitor them at the same time. So that is another way that we can work with them as well. So if you start to see increased hospitalizations from one facility in particular, that's some situational awareness to let us know of, because maybe we can work with them and their pharmacy to get them infusions there at their facility. So please let me know if there's any type of information like that you know of.
Hey, Phil.
Yes, sir.
It's Greg. I think it would be a great idea if there could be some interaction with the ED so that when ED patients come in who are positive COVID, they're treated but not admitted to the hospital, that there can, be some way of referring them to an infusion site, whether it's your own or not. I mean, I think that would be a great to help get our numbers or up, down, however we want to say. And I'm just going to call out a couple of people, and I don't mean to call you out, but I just know that you've gotten some supplies. So Tara or Diane at Redbud, are you guys using what you've gotten? Do you have a setup to do outpatient infusions of these drugs?
Yes, we are doing that currently. I'm waiting to see how many we've done. Checking with the infusion center right now. So yes, we do outpatient in our downstairs in our specialty clinic.
Great. And then also to note, this is one of those things that we did send out messaging about, but in the teletracking data that you guys are recording for all of your hospitals on a daily basis, one of those that's now required reporting is every Wednesday for the hospitals to report their previous week's inventory, what they have on hand and what they did in the previous week. So also very important for us to have an accurate picture of what you are all doing as far as monoclonal antibody therapy, that those numbers get documented. Sometimes I see all zeros across the board, but I know that hospitals have gotten allocations. So that's important because that also will affect any future allocations that we receive as a state. They could potentially decrease the amount we get based on the reporting that's in the system. So we want to make sure that that's accurate too.
I also wanted, is Touche on the line?
Eric is. Touche?
Yeah, I was just curious about them as well, whether they have an outpatient infusion mechanism set up. As you know, with vaccine, with all kinds of treatments, I know you guys deal with a large health equity clientele. Are you guys set up to use the monoclonal antibody supplies that you guys have gotten?
Was that for myself?
Yep, that's for you, Eric.
Yeah.
So I'm sorry, can you repeat the question?
We're going through as a state, making sure those populations that have health equity issues, meaning lower socioeconomic, are getting, the same treatments and that are allowed to other populations. So I know that you guys have received the monoclonal antibodies. Do you have an outpatient type infusion service set up at your hospital where you guys are referring any of your positive COVID patients that aren't admitted to that site, just out of curiosity?
No, we don't.
Does the hospital have any interest in doing that?
I can find out. I'm not sure.
If you can find out for me, that would be helpful.
Sure.
Okay. Any questions for Ashley? Okay. I do have one. Oh, I'm sorry. Go ahead. Was that Rick? Go ahead.
This is Rick. And Ashley, I apologize up front if I'm asking a question that should not be directed to you, but with regard to vaccinations, we've had considerable trouble getting additional people access into eye cares. Right now, our hospital has 2 people, and one person is going to be relocating after next Friday. And I didn't know if there was a particular department or if there's someone to contact to expedite that process.
Send me an email if you can. Do you have my email, Rick?
Yes,
Or
I
send
do.
it to Greg and we can look into it.
Okay,
Okay.
I appreciate it. Thank you.
Yeah.
Hey, one other thing that I wanted to ask Ashley, just to explain. So we know that we're posting the ICU numbers, but is the state still looking at the med surge numbers as well? Just a little clarification on that.
Right. So it is not part of moving through the tiers right now, but it is a number, the med surge numbers we do look at, like we look at on a daily basis as well. You know, knowing that that's something that we have monitored throughout the response, those are still beds we want to make sure that we're keeping track of as well. So, yes.
Thank you for that. Ashley, one other quick question, and maybe you might not have the answer for this one specifically, but for the folks that did apply to be an open pod, you know, in response to IHA's survey on behalf of IDPH, has there been a determination on those sites yet? And do you know when we could expect to know if you did submit, if you will be selected and when you'd be selected?
That unfortunately, Phil, is not a question I can answer for you. I don't know, but we can take it forward and know that you guys are inquiring, but no, I do not know.
Okay. No problem. Thank you.
Mm-hmm.
All right. Well, we appreciate Ashley for taking the time out to visit us again, share some information, and hopefully we'll get you the information that you need, Ashley. Any other time you want to come down here just to talk, if you want to visit in person when we can do that again, you're more than welcome. I hope you still, I want to make sure, Greg, I don't know, did we give Ashley a coin? If we did not, we'll get you a coin. And if you do have a coin, we expect you have it on you at all times. So, but thank you so much for taking the time out of your day. We'll allow you to get back to all the other busy work that you got for the good folks of Illinois back at IDPH. So thanks again.
All right. Thanks, guys. You guys are all doing a great job. Again, if there's anything I can do for you, just let me know and take care.
All right. All right. Greg, we'll still give you an opportunity. Did you have any additional other updates, or did that cover it pretty much?
I think it pretty much covered it. As everybody knows, and I don't want to, report something that somebody else is reporting, but, Madison County now has a mass vac site set up at the Gateway Center in Collinsville. They have requested some Illinois National Guard assistance, so I think I've heard they are working on that. St. Clair County has the Belle Claire Fairgrounds set up for their mass vaccination. As we heard this morning on the call, I believe they gave 500 on Monday, 900 on yesterday, and I believe they are pushing for 1,000 doses a day through the rest of this week. They're open 6 days a week, 8 to 8. I know some other counties have done some drive-through in their counties for mass vaccination. If anyone or you need to refer anybody, have them go to those county websites. Most of them, if not all of them, have all the information on who they're vaccinating, how to register, all of those kinds of things. So I know they are working on some the over 65, some the over 75, and of course, still the first responders who may have lagged behind, getting them done. It sounds like while we keep hearing about vaccine shortages, and I know they've run out in some counties, it sounds like the mass vac clinics are still getting supplies, so that's all good information. And I'll just go back to reiterate, EM Resource, EM Resource, EM Resource. Make sure those numbers, not only what you have available, but your capacity numbers are correct. And that, because this is how we're going to get out of tier 2. The rest of the state is either in phase 4 or tier 3. We're the only ones in tier 2. So like we said, all eyes are on us. So if I send you an email or I call you and say, hey, your numbers don't look right, that's why, because they are eyeballing them closely in Springfield. And I do apologize for bugging you with those calls. I've had to call several people, and I'm sorry about that, but they are watching the numbers closely. And I think that's all I have.
Got it. Thank you, Greg. Okay, we're going to go ahead and move on. Stars, Dale, do you have any updates?
Probably the biggest one for everybody, if you haven't caught on, is that the state of Missouri has changed their allocation processes. So what that means is that they're going to do it population-based now. And what that does for the St. Louis region, as well as the Kansas City region, is they are sending it primarily to hospitals. So in the St. Louis region, our hospital systems and St. Louis County Public Health are going to be the recipients for the entire Region C, which means all the way from Pike County in the north to Perry County in the south. And then that distribution will then go from those agencies through local public health and or hospitals as determined by each of those communities. So it's a means to get more vaccine into arms quicker. So we hope that will actually work that way. We feel confident that it will. Obviously, there are still some of our counties, even sizable ones in our region, that have not received vaccines or have received it in very limited doses. In many cases, the hospitals have been redistributing their allocations, their vaccines to public health already. It's a system that's been used so that communities can get vaccines, and we feel that it's going to work moving forward. So we hope that that's going to work out, but that's probably the biggest one. And then the state is running the National Guard weeklies, and they rotate those around. And those are hitting 3 of our counties in the more rural parts of our region. So they are rotating those around as well. So they do about 2,000. So far, they seem to be getting about 300 to 400 short each time for a variety of reasons. Of course, we're only in week 2 of it. And then they follow that up the next day or two, and they get it all distributed. So looking forward to, that building out, and hopefully it all works the way that it's planned. And certainly we hope that it works better than what we've received so far. That's probably the biggest piece of it. Like y'all, we're seeing a slow downward trend in our hospitalization numbers, our ICU numbers, and our infection rates. So we're continuing to watch that, and at this point, plan for sustained operations and everything else that y'all guys are doing too. So thanks for being on the call.
Thank you so much, Dale, for the update. Okay.
Hey, Phil.
Yes, sir.
Can I just add something I forgot to mention?
Sure.
Eastside Healthcare will begin their mass vax pods on Thursday. I know one will be at the Clyde something center in East St. Louis. They'll be set up in Lovejoy. They'll be set up in Fairmont City with National Guard Health as well. And I just wanted to let you know, the last I heard, that they need to call the health department as opposed to that they're taking, unless this has changed, reservations online. They're taking reservations by calling the Eastside Health Department and getting those set up. And so that's particularly for places or people who are in the Eastside Health District, which I think Touche is, just so that they're aware that that's how it's being handled there.
Okay, let's see. Mike, I don't know if Mike is on the line. I know he's been helping out here. Mike, oh, Mike is.
I'm here.
Any remote updates?
No, not really.
Okay, all right. Sue, I know Dana's not on. Any mental health team update by chance?
No, I don't have any mental health team updates. I haven't heard from Dana for quite some time. I didn't know if he was remote working, but last I heard from him was several months ago, and he said he was revising his volunteer list, paring it down quite a bit, but I have not heard back from him. He said he was going to give that list to you once it was done. Did it ever come to you?
I had not received it yet. So, okay.
Yeah, that's kind of where we were. He was just revising and updating his list, and he said he was going to be paring it down quite a bit, but then he was going to hand it off to you once it was done. So
I have still been sharing the mental health team line that they put out in those brochures that we've been distributing. We started distributing last fall. Those are still active. And I did have someone contact me back and say, hey, we did use it, gave it a little bit of critique, some feedback, but I'll pass that on to Dana. But that is still a thing, still working.
okay, when you talk to him, just ask him if he's got his list updated yet.
Okay,
Thanks.
thank you. All right. Okay. Quickly, we'll talk just grant status. So for everyone, our grant is still not fully executed. And when I talk about our grant, we're talking about the 20 through 21 grant. It will, per our last, Greg, correct me if I'm wrong, per our last meeting with our grants management office through IDPH, I should say, not the BJC grants management office. They're going to be working a no-cost extension for this one, since I think only a few have been fully executed. Maybe half of them out of the grants that we have across the state. But I'm hoping before the month's end, you will begin to receive an email from Christina. Again, as I asked last week, for those that were on the call, when you do get that paperwork, please try to get it back as quickly as possible. But nothing further to update on grants issues. I'm gonna open.
Was that signed by you guys and sent up?
I'm sorry. Say that one more time.
Was our grant application signed by Memorial and sent back up?
They just what I saw from last week, there was questions on one of the areas again, and I'm hoping it should be signed by Friday. It has not. I don't think it has been sent back up yet.
Okay.
I do see a hand. Give me one quick second. All right, Scott, question?
I do. I've got one quick question. I got stopped by Dr. Nukala, who's one of the vascular surgeons, who told me that her mother just got turned away for her second dose of her vaccine down in Texas. And the reason the clinic gave was it was per presidential order of everybody should be getting a first dose vaccine before anyone gets a second dose vaccine. Has anybody on this call heard that yet?
That's absolutely false here in Illinois.
In the state of Illinois, correct. I don't think that's a. I know that there is a. I won't say an idea, but a thought of trying to get out as many first doses as possible. But definitely not in Illinois. We're not doing that. But I have not heard that. This is the first I'm hearing that someone was turned away for a vaccine due to that predicament.
Yeah, she said it was per presidential directive.
Yeah.
That there's not going to be any second doses until everybody has their first.
Yeah, so I received an email from Andrew Friend, the Deputy Director of IDPH today, instructing everybody that if you've received your first dose allotment, to not save it for the second dose, because the second dose is already in the pipeline and coming. and to get rid of all of your first dose ones and to not worry about the second doses because they would be delivered. And that was today that I got that email. So there's no mention of a presidential anything.
Okay, I'll let Dr. Nucala know if I see her again walking through the hall.
Okay. Okay, so with that, I did want to talk about vaccination clinics. I know that some of our partners across the community, obviously the health departments, as Greg alluded to, and the locations where they're beginning. We are here running a St. Clair County, we're hosting a St. Clair County vaccination site here at our hospital. Just to give you a little bit of stats from what we're doing and what happened when we released those numbers or released the ability for folks to get vaccinated here. St. Clair County, as some of you in your counties have been doing, have been collecting, specific 1A personnel, like an email distribution list. Fill out this form. If you are in these categories, they vetted that list and then sent out their ability to receive a vaccine. So we were going to support that, and our goal was to do 150 per day for the 1st, 3rd, which is today, and then the 8th, 9th, 10th, and 11th of next week. So basically doing 900 vaccines for the county. Well, when we sent out, we set up we're using EMTrack that the state has provided. We set up that, we set up a clinic through EMTrack, and when we sent out, or when St. Clair County sent out the notification that folks could register, those 900 slots or appointment slots over those 6 days were all sold out in 2 hours and 50 minutes. So it went out at around 9 o'clock. At 11:50, all of them were taken. So we added an additional 30 per day, an additional 180, giving us 1,080 as a total. Those remaining vaccines, those slots were taken up in 17 minutes, that remaining 180. Now, it also looked like, just as, again, I'll just give you some feedback on what we did or what we experienced, is that someone took that list and then, got it, passed it on to a friend who passed it on to a friend who passed it on to a friend. And that it didn't reach all of its targeted audience. So we had to make some compromises with who we were giving vaccines to, but still fit the criteria of 1A and 1B. So, but it was super rapid, super quickly. So I'm not sure if anyone else had any similar experiences to that, but that was our experience running our first, I would call it a quasi-closed pod. It was open to the public, but through a restricted group of folks as identified by the local health department. Has anyone else opened a pod similarly to support the county? And have you had any, what's your feedback, or what have you experienced during your process?
How much time do you have, Phil?
Brad, come on, man. We'd love to hear.
Yes, yeah. And as probably everybody knows, we have been running that for a while now. And in coordination with St. Clair County, we did hit a specific age group parameter. We learned very quickly, we do it by link, registration link that you can go into your MyChart and make your appointment and so forth. And one of our qualifying persons is still an employed teacher over the age, and forwarded it to teachers and all kinds of people. And we ended up having to cancel over 500 appointments. We made the decision to cancel it, tried to make a physical contact with as many of them as we possibly could to explain the situation. And then really through educational processes and and informationals that are sent out through our HR department, we do really emphasize that people do not, when we send you a link, that they do not share it. That has really calmed down. On a daily basis, we probably have anywhere, we're averaging about 300 a day, and on a daily basis, we probably have up to about 10 people that really try to push the limits. We have seen false IDs. It's pretty bad when people are making a false ID to prove that they're over the age of 75 years old, and they're not. But yeah, we learned the tough way, but we're continuing on. We're working with lists. We started with lists that are people that already had MyChart accounts, simply because that was the easiest way for us to get large numbers of people very quickly. We went through that list, and now we're working with the health department on their lists and reaching out to them.
Thank you, Brad, for sharing. Yeah, I heard about a little bit of that fiasco. We dealt with the exact same thing. And I think, yeah, we finished up on a day that we were supposed to do 180 appointments. And that's how we were manned and staffed, et cetera, and overflow space, blah, blah, blah. We ended up doing 316 appointments. So because sometimes maybe grandmother, she brings her bridge partner along with, and we're doing 2 vaccines when we were only scheduled to do 1. But it worked out in the end. You know, we had to make some accommodations the first way, and now we're being a lot more strict. Like today, we've turned away a good amount of folks, but we were not able to deal with that on the first iteration for ourselves here. So Brad, thank you so much for sharing that. We are, and we did yesterday, I would say, and if there's any apprehension about the EMTrack system and if it's going up to iCare, we did verified with our folks here, our iCare representative who's leading our vaccine clinic, Pam Holbrook, that those files are marrying up in iCare properly. So Greg, if there's any feedback, if anybody asks about any feedback, we're seeing that full chain is working properly, from the registration to the vaccination and then upload to iCare. It's been seamless for us. So I think I know that there is if anybody's interested, there is I don't know if that's this Friday. I think it is. It's Friday that there will be a tips and tricks EMTrack registration thing held by Juvari and IDPH. They've made some accommodations with how they, are using EMTrack. So, and have made some, accommodations for folks that have given recommendations on what should occur. One of the things that we have noticed is that in the process of registering, if you're doing it through one of the EMTrack, and they use a thing called Pretix as the back end, if you're registering via one of those links, we use like a voucher code. So, only people who got the email, who had the voucher code inside, could use that link or had access to it, even though they probably just spread that email and people still use that voucher code. What it did was, what they thought is that they would click on the link or click on their appointment slot. It would be green, and it would come up and show, okay, here's your appointment. You're supposed to put in a voucher code and then like add it to your cart, kind of like a promo code on a website when you're buying a pair of sneakers. But some of our population, they thought they registered after they clicked on the appointment, and then they brought a print of that screen there, but they hadn't finished the registration process. So we had a lot of folks that were in that situation as well, but it was just some education and things that they'd missed. So if there's any feedback I can provide, those are the ones that I can provide on EMTrack if you are choosing to use that. We did, as I talked about with Ashley, we are set up a separate pod. We'll close this one down after the 11th. And if we are contacted back by the state and saying, yes, we'll use you as one of the open pods, our anticipation is that we'll be registered on the site, and anyone can sign up. When I say the site, the IDPH site that gives you the big list of, right, and as of right now, I think there are 311 locations across the state where you can get vaccinated. That's anywhere from hospitals, local health departments, like we talked about the Civic Center or the fairgrounds, big open pods, or our Walgreens and community or retail pharmacies that are starting to receive vaccines. So 311 sites across the state. So that's pretty good. I think, again, like I said, we're just over 1 million folks or 1 million doses administered, which is great. It's 12 million, almost 13 million in the state, and we have administered, 1.02 million vaccines so far. More to come, I guess. Anyone else with any feedback on one of their clinics?
Yeah,
Greg,
no,
you have something? Go ahead.
I would just add to that, EM Track. While there have been some issues and there are health departments who aren't using it for one reason or another, they've used the system for years and they didn't want to go away from that. Getting a lot of feedback from the ones who are using it, and almost all are complimentary. With the exception of a few issues, the ones that you kind of ran into, and I know you've sent those up to Javari to look at, but would highly encourage anybody who's going to be doing a vaccination clinic, that EM Track is a great option, and of course, it's free and paid for by the state.
Yep. And paid for by you guys as citizens. So great. And yes, the team at Javari has been really good. The support team has been really good. If you send a note to the support@javari.com, they've been really good with getting back to us and fixing, whatever, if it's user access issues or, oh no, this is how you do that. You thought you did it this way. This is how you do it. They've been fairly responsive. So, and I can only imagine how many, tickets that folks are putting in. So anyone else, again, I want to give folks one other opportunity. Anyone else with any vaccine clinic feedback that they'd like to provide? And I would like to ask Brad, are you guys prepared? If you're doing are you doing 300 a day every day, like Monday through Friday?
Yes, but yeah. The nice thing is that we do get breaks due to our second day dosing. So we don't have, those appointments are automatically made when they get their first dose. So where for instance, this week and actually today, it's all second dose work. So those particular days are very easy to handle and work, but we're averaging right at about, our highest is 400 and our lowest is about 280.
Got it. And are you doing specific first dose or second dose clinic? So it's like a week on, week off, week on, week off, so to speak, if that makes sense. Is the clinic specifically for first doses / this week second doses?
Well, yeah, I'm going to say yes, but yesterday was our first experiment with it, where it was a second dose Moderna clinic. And it was, as you do things over and over again for a while, you get very efficient. And we've picked up our efficiencies where we thought we can throw some people in to just try and get more needles and arms. And yesterday was our first run at inviting people for their first dose Moderna at the same time. And then we are the only bad thing about that is it's now a low number for the 28th day away from now. So we're kind of experimenting with it right now, but that was our only day we've done that with. And we'll figure out if we're going to do it again.
Got it. Because I always try to, in our planning, I try to, tell folks that, yeah, if you do 500, and that's what we're expecting to do, 500 administrations. But once you get to week 3, you still got week 3 or week 4, depending on which vaccine it is. You got your return folks coming, and your volume is basically doubled if you're in that position. And if you're going to do concurrent dosing, to be able to still do first doses and second doses concurrently. So, okay.
Yes, and we are seeing about a 5% that don't show.
That don't come
for their second dose. And there's just many different reasons that we're encountering for that, because we call every single one of them and ask them why they didn't make it.
Okay.
So
Great. Okay. Anything from anyone else? Floor is open. Any questions, concerns, needs? Okay. Well, we're going to close it out here. I'd like to thank everybody for all the hard work and dedication. Oh, who's that? Go ahead.
All right. I apologize. I tried to hit unmute. This is Eric from Touche. So we do have the infusion treatment. I got some confirmation. We haven't used it yet, though.
Great, thank you.
Yep.
Thank you, Eric. Okay. Again, thanks for all the hard work. We're going to get out of here. And next week we will have our hospital pulse check. So for the hospitals, please tune in. Thanks so much, and we'll talk at you soon.
Bye, everyone.